Dental implants are now the most popular method of replacing teeth that are missing, providing the ability to last for a long time and are a reliable way to make your smile back. But for those with gum problems, the concern remains, are they able to have dental implants? In this clip, we'll look at the link between gum illness and dental implants, and also whether people with gum disease should undergo the procedure. What is gum disease? Gum diseases, which is referred to as periodontal diseases, is a prevalent problem that affects gums and bone that support the teeth. The cause of this is usually bad oral hygiene, which results in the formation of tartar and plaque the gums as well as teeth. If gum disease continues to progress, it could lead to bleeding, inflammation, gums that receding, and ultimately tooth loss. Are there any patients who suffer from gum disease get dental implants? In short, it's a matter of personal preference. If you suffer from gum disease, although they are still able to get dental implants, the gum diseases must be controlled and managed prior to being able to undergo the procedure of implant. It is due to the fact that gum diseases may hinder the performance of dental implants, as the inflammation and bacteria that are associated with gum diseases can influence the healing process and connection of implants to the jawbone. Treatment for gum disease before dental implants. Prior to receiving dental implants, those suffering from gum disease have to undergo a treatment plan for gum disease and ensure it's at a minimum. This could include deep cleaning techniques like scaling and root planing. These procedures remove tartar and plaque from the gums and teeth. In extreme cases, treatment options that are more sophisticated like flap surgery or bone grafting might be needed to restore damages to the gums as well as the bone. If the gum condition has been controlled and overall health of gums has increased, the person may be eligible for dental implant procedure. It is essential for people who suffer from gum disease to consult with their dentists or periodontists in order to devise a treatment strategy to address their gum issues before attempting to proceed with dental implants. Potential risks associated with dental implants and gum disease. Dental implants may be beneficial for people suffering from gum illness. There are potential risks that you should be aware of. Patients with gum disease might suffer from a higher chance of failure from implants because of the deterioration of their gums as well as their bone. In certain instances, gum disease could result in periimplantitis. It is an illness in which the bones and gums surrounding implants become inflamed and damaged. It is vital for people who suffer from gum disease to observe rigorous oral hygiene routines when they receive dental implants in order to decrease the likelihood of developing complications. This could mean cleaning and flossing frequently with an antimicrobial mouthwash and participating in regular dental exams to assess the condition of implant and the tissues surrounding it. Patients suffering from gum disease could nevertheless receive dental implants, but they have to address and control their gum diseases before they undergo the implant procedure. Working closely with their dentists or periodontists in order to address their gum condition and to ensure their gums are healthy. People suffering from gum disease can take advantage of dental implants while restoring their smile. Make sure you follow proper routines for oral hygiene after getting implants in order to prolong their long-term viability and effectiveness.